Doctor, if you would please tell the jury your name.
Yes, I am Michael Laposata.
And how are you employed, sir?
I'm the professor of pathology and chairman of the department here at the University of Texas in Galveston.
And what college and educational background has entitled you to obtain and maintain that position?
After completing my undergraduate degree at the Bucknell University in Pennsylvania, I was an MD PhD student at Johns Hopkins. I completed both degrees and then did a residency at Washington University in St. Louis before getting my first faculty position at the University of Pennsylvania in charge of bleeding and coagulation testing. And I began to see patients there. And then I moved to the Mass General, where I was for 19 years, and saw lots of patients, adults and children. One should not be confused by the term pathology. It's not all autopsies and biopsies. Some of us are regular medical consultants, and mine happens to be for patients who bleed and clot. Then I went to Vanderbilt for 7 years, and I've been here for 11.
Okay.
And you're a medical doctor? Are you board certified?
Yes.
Okay. And sort of certified in pathology?
Yes, clinical pathology. Those are the ones who see patients, different from anatomic pathology, who do autopsies.
Okay. And do your patients include adults and children?
Yes, they do.
And what training have you had post-medical school, specifically in the issue of bleeding, clotting, and blood disorders?
Yes, during my residency, after doing the basic rotations of blood bank and microbiology, I spent a year specializing in coagulation cases, so patients with bleeding and clotting disorders, and that equipped me to start seeing patients and consulting on cases in my first job at the University of Pennsylvania for 4 years.
And have you received any special awards or recognition for your work in this field?
Yes, probably most relevant to this case is I was named the best of Boston doctor for 2 years. This is a very hard thing to do. There are 10,000 doctors in the Boston area, and they pick 200 to be featured in their magazine as the very best ones. Usually it's a result of patient care, meaning it's not for me reading a biopsy or doing anything else. It's because I took care of the cases that were referred to me. I also won a number of teaching awards. I was the best teacher at Harvard for 3 or 4 or 5 years, and I've won a few other awards, mentorship, things like that.
When did you teach at Harvard University?
I became the first director of their clinical laboratories in 1989 and was director of the coagulation laboratory, among others. And I stayed there until 2008.
Have you authored or written any books on the subject of bleeding and clotting?
Yes, I actually am the editor of what's called Laposata's Laboratory Medicine, which is used all over the world for laboratory testing for the instruction of medical students. And I've written other books, one called Standards of Care in Laboratory Medicine, and I've written the book on coagulation disorders for that, and edited the books for 5 other diagnostic areas like microbiology and blood banking.
Are those books only written in English, or are they translated into other languages?
No, they actually have been translated. To my surprise, people have decided it should be in Turkish and Italian and others. So yes, it's for global use. We have students from other countries who do our residency, and interestingly, from where they are, they've used this book.
And do you have any approximation in terms of care of actual patients that you have dealt with in terms of bleeding disorders since you began your career?
Sure. So it turns out that many doctors need specialty help on making a diagnosis about why their patients are bleeding or why their patients have blood clots. Those are the two sides of coagulation: too much clotting and too much bleeding. In an effort to assist them, we set up a program starting at the Mass General, where every case of somebody who was evaluated for bleeding and clotting came through me, and I opined on the diagnosis. I started that in 1995, and that allowed me to be involved in the diagnosis of more than 50,000 cases. And I was referred patients that I saw directly, not just looking at their test results. And we had a practice that allowed me to see several patients a week for about maybe the 13 years I was there. I still do it, although most of the time now I take specialty referrals.
Your Honor, at this time I would tender Dr. Laposata as a clinical pathologist and ask that he be able to provide his opinion in that field and as regards bleeding and clotting disorders of the blood.
Ms. Fox, any objection?
No, ma'am.
Ms. Bernard, any objection?
No, Your Honor.
Then the doctor will be admitted as an expert in the field of clinical pathology as requested by Mr. Hood.
Doctor, in this case, have you had the occasion to become involved and consult with my office about a young man by the name of Jamison Timms?
I have.
And what have you done? What have you looked at? What have you reviewed in terms of consulting with us on his case?
I have it here in front of me. Most importantly, I looked at the pictures of his arms and legs and torso. And I have 5 or so pictures that are particularly relevant. I've got a laboratory test from Erlanger over periods of time. I have data from the mother, Carrie Timms, about her medical history. I have letters from another expert, and I have emails describing the case from you and from the mother.
Okay. So in my questioning, I want to focus specifically on your review of images and records that pertain directly to Jamison Timms. Fair enough?
Yes.
Okay. The photographs that you have referenced, what is it that what do they purport to show? What do you see on these photographs?
The big question is whether or not the mark.
Okay. Speak then.
Okay, wait, hey, doctor, just one moment. We lost you. We did have a freeze of the internet for just a moment. So I think I'm going to let Mr. Hood re-ask his question and then get you to respond again so we can be sure we didn't miss any of your answer. So Mr. Hood, if you'll re-ask your question.
Sure.
Thank you. Yes.
Doctor, as regards the photographs that you looked at, we lost you. You used the phrase "the big question," and then you froze.
Yeah. So the big question is whether or not these skin changes are bruises. And just to make sure everybody understands what a bruise is, it means that there's blood that has leaked out of the blood vessel and it has pooled under the skin. So that's the question, and it has a particular timing characteristic where the blood, which is red, starts out as red because of hemoglobin, changes colors. And, we've all had bruises, so we know they go from purple and then ultimately to something lighter like green or yellow and disappear over a period of days.
And in that regard, the photos that you've been provided, what do you note about those photographs?
The most striking features of the observation are that the marks are on a mottled surface. So when you look at the skin of someone, and you could actually trace all the blood vessels with a crayon if you had to, those represent dilatations, that is expansions of a blood vessel. Imagine it as a pipe that can contract or get bigger. And the baby has mottled surface. See, you can tell that the blood flow is not normal. And then on top of this are some bright red marks, but they're not usual places for bruising. In a child that's walking, not this one, for example, you'd find bruises in certain places where a child might fall or hit themselves. In a child who's being cared for, there are bruises in certain places, but they don't follow the path of the bones. So the one picture, for example, shows this very clear pattern where the bright red marks go right along the edge of the kneecap. It just hits on the right leg, and on the left side of the kneecap just makes a circle around. And then it proceeds down below the kneecap and it stays on top of the bone. And then there's another one that's on top of the bone. And when you look at some of the others, they're the protrusion of the elbow. These are not places where you just get a typical bruise. Now, that's not to say that is there a possibility that there's abuse or somebody scraping along the edge of a bone, but boy, that's unlikely. And so that's a first clue, the mottled surface and the fact that these red marks, I won't call them bruises because they're not, but the red marks follow the pattern of the bones. So not something I've seen, and again, I've been doing this for a long time. There's something else going on here.
Did the photographs that you were sent show a time lapse as to when those marks appeared versus when they disappeared?
So I understand from commentary about the time course, and for these bright red marks to be bruises, they're not going away in a matter of hours, but that appears to be the case here. So now you have to wonder, what was it? So you can get bright red marks when the pipe bursts and the blood is there, right? You could also get bright red marks if the blood vessel just gets bigger. So you have clusters of blood vessels, and maybe there was some leaking around the blood vessel, but it really was not a bruise. This was just something that can happen because blood vessels are fragile. It turns out that the pipe, which is the blood vessel, is surrounded by something that makes it strong. And that strong element is called connective tissue. Collagen is one of the proteins that makes it strong. So obviously the question that I would ask next as a doctor here is, just looking at this child, is there a problem with the connective tissue?
Have you been involved throughout your career in the analysis and or investigation of or review of traumatic bruises caused by intentional trauma?
Yes, I have.
Did these marks that you see from November of 2021 on Jamison Timms appear to you to be bruises caused by trauma?
Not at all. Totally unique.
How long, typically, when we are bruised, do the bruises last on the body, on the skin?
Yeah, so there's a lot of variability and it's hard to date a bruise. But surely it's on the order of days, multiple days. I think every juror and everybody in the courtroom who's had a bruise has noticed that, at the end of the day, somebody would say, oh, look at that, did you bruise yourself? And then you follow that bruise for the next 2 or 3 or 4 days. I see it on family members, how did you bump yourself? So it's usually something I can see in one color or another for 3 or 4 days.
And why do bruises, as they age, why do they turn colors?
Yes, because it turns out that pigment that gives the red color, hemoglobin, changes color into something that makes it blue. That's the purple. It's red and blue. And then that changes color again, which makes it a bit more yellow. So hemoglobin degrades chemically, and the hemoglobin comes out of the blood cells because they're under the skin and they're being broken apart.
Is that rule, for lack of a better phrase, different for babies than non-babies?
Well, not to my knowledge. I mean, I think the process is exactly the same. I can't imagine the biochemistry of hemoglobin oxidation changing from neonate to toddler to adult. So I don't think there's any evidence to support the fact that this would be different.
So if a child abuse specialist testified in this case or offered testimony in this case that, in her opinion, bruises can and do appear on infants and then resolve within 48 hours, is that news to you?
Well, yes, I mean, I have to say I'm an evidence-based physician. So there's 63,000 medical journals, and I read journals that talk about bleeding patients.
Your Honor, I'm going to object to anything from the journals. He's not allowed to do that. We were not allowed to do that. Same rules.
We've got your microphone turned up loud, Ms. Fox. Mr. Hood, what would you say to that objection?
I'll redirect it, Judge.
Okay, so let me just fill the witness in. So there, on direct examination, doctor, you can't testify about what a journal said. I'm going to let Mr. Hood re-ask his question. It's a different rule on cross-examination. I'm sure Ms. Fox and Ms. Bernard will have questions on cross in that regard. But Mr. Hood, if you'll go ahead and redirect your question.
Okay. Based upon your knowledge, your training, your personal research, and your experience, is there a different rule or process for the resolution of bruises in infants versus non-infants?
I have not had experience with something that would be different for a child of this age.
Okay. All right, doctor. That's all that I have for you right now. The other attorneys will have some questions for you, okay? Thank you.
Thank you, Mr. Hood. Ms. Fox, what questions do you have?
Good afternoon, Dr. Laposata.
Good afternoon.
I have a letter dated May the 3rd of 2022 purportedly signed by you with your opinion to Juvenile Court Judge Lori Moss. Is that the only time you wrote down your opinion in this case?
Yes.
Okay. So you never did an actual report for Mr. Hood or based on any current information?
No.
Okay. And in that particular report, you indicated that you were actually consulted by Carrie Timms to review the potential marks that the child had on him in November of 2021.
Yes.
Did you know that Jameson had had a successful outpatient circumcision with minimal bleeding?
That doesn't surprise me.
Does not surprise you?
No.
Did you know that he actually healed very quickly or quicker than expected from that circumcision?
Yeah. Yes.
Did you know in the medical records from Erlinger on page 52 that the nurse noted that he stopped bleeding within 30 seconds of having his blood drawn?
That sounds fine too.
That sounds fine too. Okay.
Yes.
Did you actually look at the platelet counts from the Erlinger records?
Yeah, the platelet count was elevated. I think it was above 600,000.
Well, the platelet count on the Erlinger record I'm looking at on page 43 shows it was 449, which was in
449.
range.
You see it here.
Yeah, much lower than what you just said, but it's within the range of 15 to 40.
Oh, yes.
Did you note, or did you ever receive the Children's Hospital of Atlanta records that gave him, again, normal platelet counts of 411 and 285 respectively?
Yeah, the platelet count was not an issue.
Okay. Did you also look at the platelet volume that is on any of the records?
Mean platelet volume is normal at 7.2 for the first one when the platelet count was 449.
Okay. That would also be, as a hematologist or someone looking at the blood, something to consider.
Sure.
Okay. Did you know, or were you ever told that his von Willebrand factor was also within range?
I didn't know that. I saw that it was pending, but again, I'm not surprised. I haven't argued that it's a clotting disorder.
Okay. Is it important to look at the prothrombin time? And I'm not.
Sure.
So.
Yes. It's
Did you?
profound, yes.
Did you note that that was also within range?
Absolutely. This is not a bleeding disorder. It's a blood vessel problem.
Okay. Did you look at the factor SA to see that that was also in range?
Yep, factor eight's normal.
Okay. Were you told that the hematology came back normal from both Erlanger Hospital and Children's Hospital?
Yes, what's flowing through the blood is fine. It's the blood vessel that holds it that's the problem.
You have once said that we are underdiagnosing child abuse far more than we're diagnosing child abuse, haven't you?
I have.
Yeah. You also said that you can't tell from looking at pictures of two children with bruises which one has a bleeding disorder and which one has child abuse based on the photos alone.
Absolutely.
Okay. Did you know that Jameson had no additional bruising incidences after he was removed from Carrie and Brady Tim's homes?
No, I don't know that story. Thank you for telling me.
Did you know that he had no additional broken bones after he was removed from their custody and care?
No, that's information for me. Thank you.
Okay. It would make a difference if you're saying someone has weak vessels holding that blood in, that it only happened in their care and it doesn't happen in anyone else's care, doesn't it?
It may. It may be because in the care of one person, there is something, maybe the treatment with a medication, pain medication. I've seen people give aspirin or Tylenol to their children, and they have a modest bleeding problem or blood vessel problem, and then it gets worse, and then you move to a different place and they don't treat the child that way. So it doesn't necessarily get connected to abuse.
No further questions, Your Honor.
Thank you, Ms. Fox. Ms. Bernard, do you have questions of the witness?
I do, thank you, Your Honor. Good afternoon, Doctor.
Good afternoon.
So you were able to review the records from T.C. Thompson Erlanger Hospital from the November 2021 visit for Jameson, right?
Yes, I have them here.
Okay. And I believe the platelet count was noted on November 18th as 449 with a normal range of 130 to 400.
Yes.
So I know you mentioned that it's what's flowing through the vessel is fine, but does that elevated platelet count indicate anything to you or anything that might be relevant to determining what's going on with Jameson?
No, it turns out that many different disorders that we have, even viral illnesses and other things, raise the platelet count. This is a very modest elevation in the platelet count, so it really has no clinical significance here.
Okay. How about the red blood cell count being on the low side, 3.06, when the range is indicated to be 3.1 to 5.8?
So there is a slight decrease in the amount of red cells in the body. If I were evaluating the patient, I might try to find out if all these are connected. But really the connection to the connective tissue may or may not have something to do with this. I don't know.
Okay. And so I have a few other questions about test results there. For white blood count, I believe the result for Jameson was 6.4, which was indicated to be low in a reference range of 7.0 to 12.9. Would that have any relevance to your determination?
No, if you're looking at blood counts, white blood cell counts that are below, and if you see them, and I've seen a lot of them that are really low, you're predisposed to infection. But those levels at 6.4, that's plenty adequate enough. I would be much more worried if you were down around 1 or 2 for predisposition to it.
Okay. How about hemoglobin being 10.2 when the reference range is 10.8 to 13.3, so also a little bit low?
Yes. So it could be that the bone marrow is a little compromised through this whole thing because the white blood cells and the red blood cells are made in the bone marrow. So through whatever events were occurring, that looks like it is a reduction in, I'm guessing, the production of the blood cells. And this is something that you might follow and look at another time to see if it's still a problem. But again, those are plenty adequate. Values that would make you short of breath because the red cells carry oxygen. So if there are not enough of them, you get short of breath. are far lower. The hematocrit, 28.6, you're talking values in the low teens that would make you symptomatic. So, no, those, although they are low, are not concerning because they are not varied.
Well, thank you. You anticipated my next question about the hematocrit level as well. So then I'm going to ask you about the MCV and MCH results that were both indicated to be slightly high. Does that tell you anything that might help us understand what's going on with Jameson?
Not without further tests. The MCV tells you how big the red cell is. It's a biconcave disc, so what it means is instead of being, say, this big, it might be that big. Typically you'd worry about nutritional deficiencies of vitamin B12 and folate. Usually in an older person, there's really no dietary issues in this circumstance. And again, those values, those slightly out of the reference range, are not going to be problematic. I might add one other thing, and that is that even though you are at a children's hospital, the reference ranges for adults for a lot of these tests are the ones that they list. And without having a parallel column of reference ranges for adults, and then children at different ages have different levels. So somebody who's 2 months old might have a different reference range from somebody who's a year old. The trouble is it's hard to say what's normal because nobody wants to bring in their normal 2-month-old child and have 100 of them tested to find out the normal range. So we don't really know what the reference range is. So minor variations, especially for little kids like this, are really not an issue.
Thank you, doctor. And would the fact that Jameson was born premature have any potential impact on any of these findings or any of your conclusions regarding the blood vessel strength?
Well, that's a very good point, and I'm certainly glad you raised it. But some of the problems with prematurity show up after birth, of course. And some of those problems then resolve as you are older. So if you are a month and a half old, you might be somewhere in the cusp of whether or not you're in fetal maturity or whether or not you're brand new, newborn maturity. So when you start looking at somebody who's premature and has a pattern, especially a pattern that went away, then you start thinking about the impact of prematurity on the current condition, that is the one seen at a month and a half.
And while I'm asking you about test results that were slightly abnormal at the time, what about the albumin level that came in slightly low at 3.7?
Yes, so the main protein made in the body is albumin, and it is made in the liver. So what I saw when I saw the albumin level is a value that was a little low, but then I looked at it, it says 3.7 with a reference range of 3.8 to 5.4. On another assay, here is January 13, 2022, I looked at the albumin again, and it was 3.3 and the reference range is 2.5 to 4.6. The liver is able to make protein.
How about lipase levels? Would that tell you anything that would be relevant to your determination of what's going on with the blood vessels?
So lipase is made in the pancreas, and usually we see elevations if the pancreas is damaged. So this value, and I'm looking at the value of 14, with a reference range of 8 to 78, yes, it might have been low, but what we're really looking for the lipase are elevations. Meaning if it's slightly low, it doesn't really matter because it's a marker of injury. That is, it gets higher if you've been injured. So a value of 14, not concerning even if the reference range started at 15. What I'm concerned about are the numbers above 70.
Okay, and how about the NEUT count?
Right. So those are specific white blood cells called neutrophils. And you need to have a balance of neutrophils and lymphocytes. And so this one is a little bit low, But the total white blood cell count in the testing from this date, November 18, 2021, was 6.4 adequate. So collectively, the number of neutrophils and lymphocytes together seems fine. Would I follow it and do the next complete blood count? Sure, but that would be a routine evaluation. I wouldn't even bring the child in earlier to see how the neutrophils are doing.
Okay, and how about the sodium level? I know, again, you're talking to a bunch of lay people here, and we do hear about sodium and blood vessels and how you shouldn't eat too much sodium if you're worried about your heart. Are you concerned at all about the slightly low sodium level that was tested on Jameson?
So the answer is no. There's usually a pretty tight range for sodium, and so we pay attention to all the changes in sodium, and it's relevant if it's too low or too high. In this particular case, it is so close to normal that I don't know of any doctor who would follow that up. And I noticed that in a routine evaluation in January, now a little bit later, it did come into the reference range. It was 136, and the reference range was 133 to 42.
Okay. So would it be correct to say that even though we've got some unusual or abnormal values, that none of them were at the point where you believe they were the cause of the unusual markings?
The only one is the genetic test.
And did you look at the genetic test with the
Yes.
variant on the collagen producing genes?
Yes, I have the report from the University of Washington Laboratory of Medicine and Pathology Collagen Diagnostic Laboratory, and I think it's highly relevant.
And why do you consider it highly relevant, doctor?
Let me explain that in your body, the part that gives you structure, it's like the girders of a building, are proteins. And imagine collagen as one of the girders of a building. It's a protein that is made, and this structural protein is also important in making the blood vessels strong, so that they don't dilate too much, they don't compress too much, they don't leak. So when you evaluate a patient for a picture like this, they did the right thing to look at this really prominent protein called collagen, which is important in wrapping around the blood vessel. And they found an alteration in one of the collagen genes, which means it would make a bad girder for the building. And so the way you classify the findings in genetics is if there are 2 or 3 reports where they say this mutation has been found and it is associated with this disease, then they say, okay, then it's real. If the first observation appears, but not a second one, at the moment you're evaluating, it's called variant of unknown significance. And what that means is that it will take some time. Some other scientist studies the collagen gene and finds out that this mutation on a certain part of the gene, and it's listed here what it is associated with disease. And I give you the example of cystic fibrosis, which in 1989 we thought it was one mutation, one change in the gene. And by now we know 2,000 different mutations can cause cystic fibrosis. So the variants of unknown significance become significant over time. So the fact that you have a picture of blood vessels with connective tissue on the outside, something clearly wrong, mottled skin, changes in these in the red marks on the body, and you have an alteration in collagen, all of those puzzle pieces fit together. And the fact that this might have matured, that there might be some compensation, there is that for many disorders, that you grow out of it, right? Von Willebrand's disease is a disorder you want to grow out of. So you can grow out of things like this, and the prematurity is classic. So this can all be associated with that. And there are different kinds of collagen, and the other kinds may have compensated for what was problematic in a month and a half.
Thank you very much, doctor. And I have one more question about a test that was done at Children's Hospital in January of 2022, where they attempted a reptilase and thrombin time, but the samples clotted prior to arrival. I've been waiting to get to ask you, the clotting expert, about whether that has any relevance or significance, whether perhaps we should have gotten those thrombin and reptilase levels retested, or whether there is any concerning information there that has any bearing on your diagnosis or analysis.
Yes, so let me explain the clotted samples. So when you have to do tests to look at clotting, the clotting can occur in the tube. You have to keep it so it's not clotted in the tube, so when you can take it out of the tube and put it into a machine to do testing, it's liquid. So to make it so it's not clotted, there's a little bit of blood thinner in the bottom of the collection tube. You put them in there, but you have to mix it right away. And so there are a lot of things that could go wrong, where if you don't mix in that little bit of blood thinner in the bottom, in the tube, upside down, you can end up with some clotting in the tube, and then you can't do the test. Now, if I were to look at the child now, I would do it really from scratch. How old is the child right now? What are the clinical problems? And I wouldn't be over aggressive. I would try to explain what happened before, with the understanding that whatever happened then might not be in play now. Because that's true for a lot of things, especially take infectious diseases. When you're sick with COVID, you're not the same as you are when you're better. So your blood tests are going to look different. So if things look like they're resolved, I would do regular evaluations. All that said, I would do whatever I could to find out as much as I could to explain the events at the time that these skin changes occurred.
And if another medical provider had testified, well, it doesn't matter that the samples clotted, we didn't need them anyway, would you consider that best practices?
Well, of course not. I mean, what that implies to me is it's a bias. So if you've made up your mind already that it's child abuse, then you don't need any tests. You looked at the child, that was the point that I made that was quoted earlier. You look at two kids, you can't tell which one has a bleeding disorder and which one was abused. You have to do evaluations. You have to understand the whole picture. So, no, I mean, obviously it would have been relevant. The only reason it wouldn't have been is if you decided this is child abuse before you went any further.
Thank you very much, doctor. And on that subject, so you have reviewed cases of child abuse and offered diagnoses that suggest that inflicted trauma was an issue. Am I right?
Yes, I've reviewed probably 300. I do it pro bono. I learned in the first case that people have to pay the attorney, so I don't want to make their problems worse if indeed there's an underlying bleeding disorder. So we do it for free. I usually have a team of people I consult because I don't ever want to be wrong, and I want everything to be evidence-based. So I run it by people and say, does this look right to you in a conference? So we take the same level of being meticulous for a child abuse case, which is often just boom, decided early by a pediatrician. And even though I can look at it and say, boom, it looks like von Willebrand's, I don't want to say that. I want other people to tell me they agree. So this is as important as a cancer diagnosis or anything else. So we are meticulous about it, and we see it as part of our mission of taking care of sick patients, and that's why we don't charge it.
Well, thank you very much, doctor. And my final question will be, based on your review of the medical records, photographs, and other materials that you have seen on Jamison Timms, do you see evidence of child abuse medically?
No.
Thank you very much, doctor.
Thank you, Ms. Bernard. Mr. Hood, do you have any additional questions of this witness? Ms. Fox, do you have any additional questions of this witness?
I do, just a couple. You were consulting strictly on the presentation in November of 2021, weren't you, Doctor?
Well, I had other information, and I believe I quoted some from later dates that, I'm looking for the date of the genetic testing, but I
Right.
did have data, lab data from 1/13/22, and this is from Atlanta.
I think my question is that you were trying to give an analysis of the appearance of the photos that you were given from November.
Oh, that's true. I mean,
Yes. You are not making an opinion as to whether or not the 3 broken ribs were child abuse, or whether the compression fracture was child abuse, or whether the cut under the tongue was child abuse. You were looking strictly at the bleeding in November.
And Your Honor, I will
Wait
interpose.
just a minute, wait a minute, doctor, just a minute, I've got an objection here. Ms. Bernard, what's the objection?
Your Honor, I will interpose an objection as to the characterization by the prosecution of matters that have already been disputed by other experts. So to the extent she is attempting to present them to this witness as facts that have been concluded, that is precisely why we are consulting numerous experts to determine whether or not there was a compression fracture and whether or not there was a cut under the tongue, since the child abuse pediatrician failed to document or photograph the alleged cut.
Okay, Ms. Fox, your response to that objection?
Your Honor, I have him on cross-examination. He was asked by the defense whether he thought there was child abuse in this, and he said no. And I am trying to clarify that he's not making an opinion as to the 3 broken ribs, or as to a compression fracture, or as to a cut under the tongue.
So I'll let you re-ask your question. Perhaps that's kind of a compound question, so let's break it down. So I'll let you ask it accordingly.
Dr. Laposata, you are not making an opinion as to the 3 broken ribs, are you?
No, I took all the information into account.
Okay.
I just not commenting on cause of or how these changes occurred, but I was well aware of those changes.
And you are not making a comment one way or another as to the cut under the tongue?
Yes, the frenulum dot, same picture as I saw on the skin, so it didn't cause me to think any different.
Okay. And you're not making a comment one way or another as to the, I will call it for purposes of this question, the alleged compression fracture?
I'm not making a comment about that, only to say that I'm aware that it was in the notes.
Were you aware that as to the variable of unknown significance in the qual 1A2, that a number of experts have testified that it was not likely to be clinical in this particular setting?
And Your Honor, I will interpose another objection.
Wait. Okay, what's the objection?
And we have had numerous geneticists, we have had 2 geneticists testify. The only person who said there was no way it would become pathogenic was a pediatrician with no genetics training whatsoever. So again, I object to the mischaracterization in the state's question.
Your Honor, I disagree. They called Dr. Pauls, who is the expert that puts it into the actual database, and he said that it is not the cause of the OI or anything in this case, that it was a big nothing burger, and we have wasted a whole month talking about it.
Ms. Bernard?
I would strenuously disagree with the state's characterization of Dr. Paul's testimony as the genetic variant on the collagen-producing gene being a big nothing burger. He used the precise same analogy that this expert has used regarding collagen and its role in steel girders, and the variant of unknown significance that we do not know whether it could be pathogenic, but it has certainly not been found to be benign.
Okay, so I'm going to sustain that objection.
Thank you, Your Honor.
I don't, as to Dr. Paul's, I'm going to sustain that objection. I'll let you ask your question to this witness.
Thank you. You indicated, I'll rephrase it a little bit, Your Honor. You indicated that it was a variable of unknown significance, correct?
Yes.
And the report itself says it's likely not to be affected clinically, doesn't it?
Yes, it says that and more.
Okay. And then my next question would be, experts in this court have testified that it did not affect this particular child. Would you agree or disagree with that statement?
I actually think it probably did because all the other findings are consistent with a defect in connective tissue.
In this particular situation, would it surprise you that he has not been diagnosed with osteogenesis imperfecta by either of his geneticists?
It's not. There's so many different disorders of connective tissue. Not having osteogenesis imperfecta doesn't rule out the other hundreds to thousands of disorders associated with bone or connective tissue.
Would it surprise you that the two geneticists who've actually seen Jameson didn't diagnose him with anything?
No, seeing a child doesn't look at the genes. So I can tell you just what somebody else says about genetics, even if they looked at it, because the answer is in the genetic test result.
And is it also true that a lot of variable of unknown significances actually turn out to be benign and are not causing diseases ever?
Sure, if there were no other findings associated with connective tissue problems, I probably would have relied on this as probably being less important. But in the presence of the pictures and the changes and skin changes and prematurity, I mean, it all fits in that story.
But you do think it's highly relevant that he hasn't had this condition with any other caregiver?
I've certainly seen plenty of cases where things changed over time. This is no place to reiterate every one of those examples. But yes, there are plenty of explanations why something happens at a certain point in time and doesn't happen after that.
Thank you, Doctor.
They're benign explanations.
Anything else, Ms. Fox? Mr. Hood, anything else of this witness? Ms. Bernard, anything else of this witness?
Have any of the questions you have just been asked changed anything about the assessment you made regarding the likelihood of Jameson Timms being a victim of inflicted child abuse?
I think it's extremely unlikely to the point of being almost an impossible explanation. It's a challenging world for a pediatrician who wants to do a great job and not miss cases. And 19 out of 20 people, children who have these marks, actually are beaten. So our goal is to find the one that's not. And when that happens, that's when we step up and do the work for free.
Thank you very much, Doctor.
Anything else of this witness? Ms. Fox? Ms. Bernard?
No, Your Honor. Thank you, Doctor.
Doctor, thank you for joining us today on Zoom. And that would conclude this portion of the case for this witness. And sir, I'm going to go ahead and exit out of the Zoom room. Again, thank you for joining us today.